In a recent research, it has been estimated that about 55 million men and 110 million women live with infertility globally. Age is a factor. So, the age at which most women, especially in this century, decide to start a family implies that infertility would be more than ever. For example, a woman who has lived most of her reproductive life on chemical contraceptive, perhaps for education, career, or business, whatever it is, would discover that when she is ready to start a family, fertility would have eluded her. So, the longer the use of chemical contraceptive, the more damage caused to the reproductive system, and usually the cervix is the last to recover. So, part of our responsibility is to educate young people on all aspects of their reproductive life. Let's look at the male aspect of it. Fertility also declines in men, although to a lesser degree than it happens in women. And even though men have had children while they are 90, there is a risk of fresh gene mutation in sperm, which leads to a lot of congenital abnormalities, including autism. So, men also who are above 35 would have half the chance of achieving pregnancy than if they were 25. Finally, the expectations on fertility treatment is steadily rising, especially in a society where most people are certain about their rights and go for it, without sometimes having a deeper knowledge of the responsibility that comes with this, such that they don't believe in the failure rates of these technologies. So, fertility management is actually more complicated than the hopes offered or presented by these technologies.